Hi, Dr. Moore. You're praising parents who get their kids vaccinated before sending them off to school. You've had over the past few weeks several groups ask for COVID vaccinations to be added to the list of mandatory shots for students. So far, you've kind of postponed making a decision on that. When is a decision coming? Why hasn't that happened before school started? And are you just waiting for a vaccine to be approved for kids under 12?
Oh, so several questions there. Just in terms of the vaccine for 5 to 11s, we have heard from the federal government that that's being reviewed, that we may get information in early winter regarding possible rollout for that population. So I'm looking hopeful that we'll have it during that time frame. In terms of mandating the reporting of vaccination, what we've done is we've worked with our health units and our school boards and have created an electronic solution to minimize the burden on parents on reporting so that now we'll be able to get an electronic record of who is in what class in what school. That will get integrated into our COVAX tool, so we will understand at a local public health level how many children are immunized in each classroom and in each school. So this is a seamless electronic means that will allow public health to understand who's vaccinated in what classroom and what proportion of schools have high levels of protection. So we've gone beyond the requirement of mandating a parent to report to making it seamless and electronic, and we've informed the Privacy Commission regarding this. This is a real-time means by which public health will understand risk in any school. We will have COVID-19 activity in schools across Ontario. That's natural. It reflects what's going on in the communities. But now we have this additional electronic availability that enables public health to understand in almost real time the risk in any classroom. So I think that is the best solution in a short time frame that we could achieve, and I think it meets the needs of public health, it meets the needs of parents as well as school boards.
Follow-up?
So the runny noses were recently removed from the list of screening symptoms for having to keep kids out of school, but you've just said now that parents who have a child who has a runny nose should also keep that child out of school. So can you give some clarity as to what parents should be doing if their kid has a runny nose, and why was that removed from the list of symptoms from the screening?
Very good question. So we did an evaluation, and many health units contributed to this. Of the 100 children that got tested for a runny nose, only 1 out of 100 would have tested positive for COVID. We thought that was an undue burden for parents to try to find one child to test 99. The vast majority of them would have had an allergy or rhinovirus, which is very typical this time of year, and it would have been an undue burden on parents and schools and the testing capacity of the province. So given that low positivity of just the one symptom of runny nose, we've excluded it. It will, though, require, if you have a runny nose, to stay at home to see if the symptoms are resolving or improving, and the child could then report back to school. So we thought, from a patient perspective, a parent perspective, this was the best solution.
Next question.
Your next question comes from Mike Crawley from CBC News. Mike, please go ahead.
Hi, Dr. Moore. How confident are you that these plans that are in place for schools are strong enough that school closures aren't actually going to be necessary?
Good question. Good analysis from our federal partners across Canada that looked at where children actually pick up COVID-19. And this was just recently shared with us last week. 87% of the time when a child got COVID-19, the virus actually spread within the social circumstances, in the home or after school activities. Only 7% of the time was the school the source for the infection. And the remaining percentage, around 6%, was in daycare settings, preschool, after school. So I am confident that the school setting itself is safe. We've put in many precautions. We will see outbreaks, we will see activity in the schools, but they basically reflect what's going on in the community. Our goals a community should be to keep our rates as low as possible, and that way our schools will remain safe. And parents, we all have to be very cautious of our after-school activities. The more contacts we have when you have COVID-19 in your community, the higher the risk that your child is going to get the infection or illness. And so we all will have to be cautious as the rate and risk increases, and we do anticipate increasing in the coming months. We'll have to reassess how we socialize after school settings. We have also done tabletop exercises with all of our school boards to prepare them in partnership with their local public health agencies for outbreak management. And it's our goal to be very precise and limit any effect on schools, classrooms, and or broad-based closures by being aggressive in outbreak management, by limiting the spread in communities, and also adhering to all the best practices in the school settings. So I'm confident, but it takes a community to keep our schools safe and keep our community rates low. Many communities are doing that as we speak. And where there are increases in activity, and I'll just use Windsor as an example, the Medical Officer of Health, Dr. Wajid Ahmed, has already put in recommendations because their rate of illness is around 100 per 100,000 today. He's put in recommendations in partnership with the school boards to limit assemblies, limit high-risk sports, to best adhere to cohorting, hand hygiene, and other public health practices to limit the spread, and in that way further protect our schools as a possible source for infection for children. So I hope across Ontario that we can work at a local level to protect our schools when we see community rates go up, but we all have an obligation to keep our schools safe by getting tested, isolating if you're positive, and letting public health do its great work on finding and limiting the spread of infection in all communities in Ontario.